Hello everyone, the next topic that we will deal with is post and core, or also in many books it has been also named as restoration of endodontically treated teeth. So what exactly is post and core and why we need that? Post and core means a teeth which has been no crown is there, the clinical natural teeth crown is not present. What will we do with those teeth which we has only root and little bit of little crown left? Can we do anything with those kind of teeth? Endodontic treatment can be done in those teeth, and then what? What about the restoration part? So for that we need to know and learn about post and core. Post and core. Post means a dowel, something which will go inside the root. Core means something which comes on the top, as the name suggests. So now let's see what are the factors that influence the choice of technique for restoration of endodontically treated teeth. So the choice of factors that are responsible are the case history, the dental history chronology of the periodontal and endodontic treatment history. Radiographic examination is required, and in radiographic examination what are we supposed to see? We are supposed to see the lamina dura of the patient, of that particular teeth. We have to see the periodontal support, we have to see the alveolar bone support, we have to see if there is any resorption or bone loss specifically. Intraoral examination, periodontal examination, gingival examination. We have to also see occlusal examination. If there is any hard load coming over there, is there any presence of plunger cusp over there? Important consideration include the amount of tooth structure which is lost, also the amount of tooth structure which we have right now in our hands. Anatomic position of the teeth, occlusal forces that will come onto the tooth, occlusal forces that will be observed by the tooth, restorative requirement of the teeth, like for example, if it is an anterior teeth, it is more aesthetic person. If it is a posterior teeth, then we have to go for the forces and restoration of the teeth. For mastication is important. Aesthetics requirement of the teeth, that is the tooth has in the anterior region, then we have to go with some different kind of pose, because if it is a metal pose, the color will be coming out. So these things are considered before going ahead with post and core. Let's see some terms which are related to post and core. Post, also known as dowel in older days, refers to a cylindrical or tapered object that fits into the prepared root canal of a teeth and is synonym with the term post or endodontic post. This is the post which is going inside the root canal. Here we have the gataparcha still remaining, and from this level you can see is the post. Here, see, this is the post. We have gataparcha still here. Core refers to a build-up restoration which is there, usually amalgam composite placed badly, broken down teeth or bulk to increase the bulk. Because we do not have crown sufficient structure, then we cannot place our restoration onto that. So facilitate subsequent restoration by means of indirect extracoronal restoration. Coming to another term which we will see is ferrule, or also known as vein. A ferrule is a metal ring. See, basically this is a definition of Rosenstein, which says a ferrule is a metal ring or cap placed around the end of the cane of the tool added to the strength. Basically, ferrule in our post and core is what? It is that amount of vertical sound tooth structure, the vertical sound tooth structure which is present above the root from where the crown is supposed to come. So that particular, we'll see how it is and what is it. The ferrule is the most important thing in post and core. All the theory runs behind and around ferrule. Pins are used along with combination of post at times, but pin related restorations are almost not undergone these days. Indications, what are the indications for post and core? Those teeth that we want to preserve for more preservation, for aesthetic or function, and the root is remaining and little part of the crown, that is around 2 mm at least, is remaining. Those teeth we can go ahead with post and core to preserve the teeth over there and give the natural crown over the natural root which is present. For those are the indications of post and core. Also, we do post and core in which cases where we know that we have to give a fixed partial denture and the other side has no tooth but just a root surface left. So we will do endodontic treatment to those and we will build up a core and place a crown over there. Coming to contraindications, severe curvature of root if present, like laceration of the root, Persistent periapical lesion if present, we cannot go ahead with post-in core. Poor periodontal health, a poor crown to root ratio which is to be optimal at least 1:1 if it is not present. Weak or fragile roots if it is present, again we cannot go ahead with post-in core. Massive resorption if present, we cannot go ahead with post-in core. Teeth with heavy occlusal contact or plunger cast, in those patients also, in those tooth basically also, we are not supposed to go with post-in core. Patients with unusual occupational habits, for example like biting with the nail tip of the incisors, the wires or threads, those patients, or the patient who have parafunctional habits, we cannot go ahead. Economic factors and inadequate skill of the dentist is also another shortcoming or contraindication of post-in core. Coming to ideal properties of post, how it should be biocompatible, it should be engaging the dentine. See, we can see here threaded, active post. These are, post can be of two types. We'll come up to definition, classification of post. Now the ideal property should be, it should be biocompatible, it should not cause any resorption of the root, it should be holding enough, it should not break off, its modulus of elasticity should be equal to that of the dentine is what we say. But metal do not have that. Only fiber posts do have that modulus of elasticity equal to that of the dentine. Also the ideal property will include like the post over here should not cause an infection periapically. This force which is given onto the occlusal surface transferred to the post should not cause hamper the breakage, or it should not break the roots. These are the ideal properties for the post. Core materials, what are the requirements? Again the same, it should not break off. It should be there permanently using the ferrule of the effect. It should be present. It should be attaching to the post. Another important thing is attachment with the post is important. Fourth important thing is it should be very much rigid present over there. And important part of core material is it should be aesthetically pleasing as well, and it should be taking over the compression strength which is coming, the occlusal load which is coming. Now coming to the restoration part. Now restoration part, we will have an artificial crown over there. We can see there is a post, we have an artificial crowns on the top, and we have a pontic here. Everything is supported by, see there is a post, here is a post, here is a post, and some amount of gatta pascha left behind. Now what are the different features of post? Post can be active post or passive post. Active post that engages the dentine. Passive post, those are passively present in the dentine and they are engaged with the help of cements, luting cements. Active post, the disadvantage is at times when it is coming out, when we have to remove it, it can fracture the dentine, it can fracture the root because of its active property. Whereas a passive post disadvantage, it can be removed easily. So these are the active and passive posts present. A post can be prefabricated or a custom fabricated. A prefabricated post is again classified into two types, metallic post and non-metallic post. The metallic posts are the one that we make it intraorally or we get it from the market, that is we have the prefabricated metal post. Non-metal posts, those are the carbon fiber post or the fiber post, glass reinforced post, also quartz post are also available. So coming to the classification of post, prefabricated, custom made, active, passive. According to post design can be smooth, serrated, parallel threaded, tapered, combination of all these. Now let's see what are the classification, how is it going ahead with. Now coming to this according to post design. Smooth post, no serration, smooth post. Smooth post, no serrations. It can be smooth in its structure. Now once it is smooth in its structure, now it can be either tapered or it can be straight. If it is straight, the disadvantage is that the lower portion will have much preparation requirement. Post space preparation in the end area will be much because it is always tapering at the root ends. Whereas a tapered will be easily fitting there. What is threaded and serrated? Like in our fingers we have these lines. When a post will have these lines, these are called threaded. Serrations are what? In these lines if you have a vertical slots again. Why are these so many slots? Threaded, serrated are coming up to increase the surface area. so that the engagement with the dentine and the luting agent is in more surface area. So that's the reason these changes have came over in the post. So these are all the different kind of posts that has come over in years together. So we can see these are the metal posts which are prefabricated, tapered posts, these are the threads which are present. In these threads, if there would have been a cut on the threads, then that would have been called threaded and serrated also. Now these are the smooth post or the fiber posts that is present, and these are the drills of the post. Every post that you get in the market comes with a drill. So the drill number which you are using, the same post will go inside. Depending upon the post space preparation, space for the post by the help of these drills which we get in the market. Now post design, which design should we use? I suppose that active design in a very harsh way should not be used, because we are anyways engaging it down to the dentine, and which is very fragile for that matter. Modulus of elasticity is also not that same for active post. And which post will give more retention, so that we will come through. So retention form and anterior teeth, that will be decided by preparation geometry. The post length, we will all discuss in details about these. The post length, how much it should be, the diameter, how much it should be, surface texture, retention form and luting agent, what we should be using. We'll come to one by one. Before all that thing, we know that endodontically the teeth is prepared. The teeth has been root canal treated. So we have gutta percha left inside the canal. So with the help of a piezo reamer, now firstly we are supposed to remove that gutta percha to some amount of extent, to that amount till we want our post to go. So that will decide how with the amount of the post length that we are supposed to do. So how much length are we supposed to keep? The length that we are supposed to keep for a post is, with different concepts are there. Rosenstiel says 3 to 5 mm of gutta percha you leave behind and then you restore with the post. Schellenberg says 1/3 of the entire length of the root or the crown has to be left with the gutta percha, and then you fill with the post. So there are different concepts of post length on the amount of post length that should be there. Now why is that important? What if we have a short post? Now in case we have a short post, what will happen if this is my root length and my post is somewhere till here short? So from here till here the fulcrum line is near. So the fracture will happen more. The lever arm will act and the fracture will happen here. Whereas if my post goes till down, the fracture, this length is increased. So the lever force is increased. So now the fracture is difficult to happen. So post length is like that. Coming to the post diameter, what it says in post diameter is, Schellenberg says keep 1 mm everywhere. Rosenstiel says 1/3 of the entire tooth surface, sound tooth structure, should be present at any point of given time and place. That is, whether it is apically or cervically, at least 1/3 of diameter should be present of the sound tooth structure. Coming to post surface texture, there is no recommendation of surface texture that you are supposed to use a smooth, you are supposed to use a serrated or any other such kind of thing. But yes, that surface texture whatever we are using has to be accurate, for the matter that if we are using an active, that we need to see we have enough space in the dentine, the tooth structure is sound. So then we can go ahead with the active kind of post. Now for post diameter, different philosophies of post diameter has been given. The conventional, the proportionist philosophy or the preservationist philosophy. Let's first see the conventional philosophy or the conservationist. Name itself is saying conservationist. So something, that philosophy which is saying you have to do minimal instrumentation of the canal after removal of gutta percha. Instrumentation should be limited to the undercut areas, endodontically treated with smaller diameter dowel, resist fractures better. So that is the reason they are saying use smaller diameter post, enlarge the canal till clean dentinal shavings extruded from the orifice is done. This is a the conservationist theory. Now next is the preservationist theory of post diameter. Or let's see what is the proportionist theory first. Proportionist theory says that the diameter of the dowel should be 1/3 of the diameter of the root. Wherever it is given, the dowel space should not exceed 1/3 the width of the root at its narrowest dimension at least. They suggested that 1/3 relationship preserved sufficient tooth structure to resist the tooth fracture as well. Now, so what was the preservationist had to say? This philosophy of dowel diameter depends on the minimal thickness of the dentine surrounding the entire dowel to prevent the tooth fracture. At least 1 mm of sound dentine must be maintained around the entire circumference of the tooth. So these were the different philosophies advocated with the post diameter. Coming to the Kray's lines, which is there. Now Kray's lines, as we know, what is Kray's line? Kray's means anything which is a fracture or there is any kind of micro cracks, that is called Kray's. So if the Kray's lines are the present, if it is present, we cannot go ahead with that of the post and core preparation. Now Kray's lines, which is the micro fracture or the cracks which is present, has to be determined or can also be present because of the post that we are using. If we are using an active post, even that can cause a Kray's line into the dentine. Rotational resistance. Now what is this rotational resistance? Also, this is also known as in Schellenberg anti-rotational resistance. The word should be actually anti-rotational resistance. That means something which will not allow rotation to happen. Anti-rotational. So if it is round, the post can remove from any place to any place. Now if I have something like here, round and some structure in the front, so what will happen? It will get engaged in that area. Like in a bulb, when we are fitting a bulb, we know that there are two holes of the bulb which we have to fit in that area and then put a slot into it. So then the bulb will not rotate over there. So it is fixed in one particular place when we are putting in a holder. Similar characteristic is advocated in this anti-rotational resistance characterization of post and core. Preparation of the canal. How do we do that? So we prepare the canal with the help of Gates Glidden, and we have different we have different drills present or in the prefabricated kind of thing, and we have drills that we will go ahead with. Now before that we have to enlarge the canal. That is accomplished with instrument like piezo reamer or a low speed drills. The purpose is to remove the undercuts and prepare the canal to receive an appropriate sized post without excessively enlarging the canal. Now before starting canal preparation, remove any existing restoration, caries, bases, thin or unsupported walls of the tooth structure, preserving as much as tooth structure as possible. Now coming to the ferrule thing which I was speaking about. Coronal tooth structure, which is importance of ferrule is a band that encircles the external dimension of residual tooth formed by the walls and margins of the crown. It can be formed by the margins of the crown, number one, which have to have a sufficient amount of natural tooth structure present, at least 2 mm of natural teeth structure present in the core, and then you can build a core with any other material. So different techniques are advocated. There are different methods of making impression or making the post. That can be direct technique or direct procedure, which can be done intraorally. It can be indirect technique which can be done over the cast in the laboratory. Coming to direct procedure, how do we do that? So direct procedures can be done with many materials. Best material is to use is pattern resin. You take the pattern resin, mix the pattern resin and make the material flow inside the canal. And you prepare the core also with the help of the pattern resin. And when it sets, now you have the first apply glycerine into the canal. Now when it sets, you remove it and you check for the fit of the acrylic resin, that is a pattern resin inside the canal. Now you got the impression of the canal inside. Now you can directly cast it in the casting procedure and that acrylic will be converted to metal. Another procedure is using wax. How you can do that, or even using a J-shaped stick like in this indirect procedure. Like what we do in indirect procedure, we keep a J-shaped wire is reinforced inside the canal, and this is a stock tray in which impression material is fixed. That impression material will flow inside the canal, and when you remove the impression, then we have impression material on the top you have a J-shaped wire influenced, and onto that the impression of the canal. So now when you pour it, you will have a crown, you will have a tooth which will be hollow from inside once you remove the impression. So this is indirect procedure outside the mouth. Now what are the desirable properties of core? Now it should have high compression strength, the dimensional stability should be there, it should be easy to manipulate. The short setting time is another important thing, because you are doing a direct procedure. Too much of setting time is there, patient has to open the mouth long time. And ability to bond with both the tooth and the post. The core has to bond with the post as well as the tooth. So that's another desirable property. What are the different core materials that are available? So now what are the different core materials that are present? It can be composite resin core, it can be cast metal core, it can be amalgam core, glass ionomer core, modified glass ionomer core. Let's see in short each fataphat. That is, let's see fast in all. What are amalgam core? What are the advantages of these material? It is not technique sensitive. Yes, of course, it is strong in bulk section, whereas it can be sealed by corrosion products. Disadvantages being it is weak in its thin section and best left to start for after 24 hours before the tooth preparation. Also, that it has a potential electrolytic action by the core and metal crown if present in the opposing side. So that is a disadvantage, and it is not intrinsically adhesive material. So this is coming to amalgam. Next, let's see the resin composites. The advantages being it is a strong. It can be used in thinner sections than that of the amalgam. Yes, it has a fast setting, does not always need a matrix, that is during the placement of the material. Whereas the disadvantage of this material is also there, that is very technique sensitive, and it replies a multi-staging dentine bonding agent is required. Material shrinkage happens over a period of time, so that means dimensional changes are there in these kind of material, and it is distinguishing is difficult between the tooth and the core during the preparation of the material. Coming to glass ionomer cements, the advantages are that it is intrinsically very adhesive, whereas it has a fluoride release. That's another advantage. We have similar coefficient of thermal expansion as that of the tooth. Whereas the disadvantage of a glass ionomer cement is it is weaker than the amalgam or the composite, and it has a tendency to crack. Some are also radiolucent in structure. So came this modified glass ionomer GIC. Now that was stronger than the regular GIC, of course, but either intrinsically adhesive or with a simplified bonding system it came up. Fluoride release was also there. Disadvantages being weaker than that of the amalgam and composite, though can crack the overweight products when it comes over to it. The occlusal force, it may crack out. Some materials can inhibit surface setting of the adhesion silicons and non-reliable as it is an interim restoration. It cannot be relied as an interim restoration. So these are the different core materials. What are the different luting agents that we can use? We can use zinc phosphate cement, we can use zinc polycarboxylate, zinc glass ionomer cement, resin modified glass ionomer cement. Now, can we all appreciate that all these cements are a classification under permanent cements? So, out of which the zinc phosphate and zinc polycarboxylate and GIC is a very strong amount of cement. Nowadays, they say if you are using a carbon post, you are supposed to use a resin modified glass ionomer cement for cementation of the post. Whereas earlier days when we were using metal post, even normal glass ionomer cement or zinc polycarboxylate also gives a very good retention or cementation of the post. What are the recent advances in post and core system? Now in an earlier lecture I had told you in the earlier class that this does not have a modulus of elasticity equal to that of dentine, the metal. So now came up something new which had somewhere equal. Carbon silicon fibers were something which was newly discovered, which had this optical property also very good, and also they had the modulus of elasticity as equal to that of dentine, near about equal. Carbon fiber post, they had white coated glass fiber post. Nowadays we have ceramic post, we have double taper radiopaque translucent fiber post. This is most nearest to the modulus of elasticity with the dentine. Trans-illuminating post are also, they have a company called lucent anchor posts and twin lucent anchors. This twin lucent anchor and lucent anchor post, they are also light emitting posts. When they are putting inside, they have a light, so we know exactly how much depth the post has gone, and also the modulus of elasticity. The cutting of these posts are also easy. You can just cut it off with the serration which is present with the help of normal scissors. And the cementation is to be 100% done only with the help of modified GIC, that is modified glass ionomer or resin cements. Also, one thing to end before post and core to end is that if I want to retrieve my post and core, is that possible? Yes, it is possible. Now, to retrieve post and core, you have different techniques or kits. Different kits that are available in market is measurement kits, which is available. That is like this kind of hole it is there. So it will go and will hold the post and will take over the post out. Secondly, we can use our normal probes. We can, or use our ultrasonic vibrators or the scalers, which we can give the ultrasonic pressure onto that. We will make the post loose in its area and then remove it out with the help of tweezer. That's another technique, easy removal of the post. Before removal of the post, you have to also dig around the crown, the area of the root in the orifice region, so that the exact holding of the post is easy. Measurement kit is one of the beautiful kit to remove the post for the matter when post and core is to be removed. Thank you.